just count like the vertical. Alright, good job. Good job. And then count this way, horizontally. Okay, good job. Okay, and then multiply those together, and what do you get? Alright, 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 alright. And is this shape filled in all the way? Is this shape filled in all the way? Okay, okay. Good job, good job, good job, good job, good job. So now, tell me which finger is farther from you. Which finger? The right or the left? Alright, good job. What about now? What about now? Okay, good job. What about now? What about now? Good job. What about now? What about now? Good job. What about now? What about now? Okay, what about now? What about now? Good job. What about now? What about now? What about now? What about now? Relax, close your eyes, and tell me whenever you feel it, whenever you hear it get closer to you, and whenever you hear it get farther from you, okay? Okay, good job. Good job, good job. Okay, one more time. Good job, good job. Okay, now we're gonna do it with a different frequency. So I need you to tell me if this frequency is higher pitched or lower pitched than the one we just heard, okay? Okay, can you hear that? Good, good, good. Alright, good job, good job. Now tell me when it stops. Alright, good job. One more time, one more time. Okay, good job, good job, good job. Okay, now I'm gonna whisper a word into your ears and I need you to tell me what word I'm saying, okay? Watermelon, watermelon. Hey, and don't do none of that, alright? Polo shirt, polo shirt. Okay. MacBook, MacBook. Okay, okay. Vitamin, vitamin. Okay, okay. Camera, camera. Alright, now I'm gonna do numbers, okay? Now I'm gonna do numbers. And just tell me what numbers you hear. 51, 22. Okay, good, good, good. 36, 12. Good, good, good. 18, 11. Good, good, good. 7, 12. Good, good, good. 6, 7. Alright, good, 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 good. Now, I'm gonna whisper. I'm gonna whisper into your ear, and I need you to tell me whenever you hear it stop. It's not gonna be anything you can, like, understand, but just tell me whenever you hear the sound stop, okay? Alright, good job, good job. I'm gonna do it one more time, one more time. Alright, good job, good job, good job. Good job, good job. Now I'm just gonna write down your results again. I'm gonna write down your results again. Just stay still. No peeking, no peeking. Alright. Now I have these scented markers. And I'm just gonna wave it under your nose, and I need you to tell me what it smells like, okay? So first I'm gonna grab this one. Oh, there's no flavor on it, okay? Okay. What does it smell like? 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 Alright. Green apple. Good, 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 good. Good, good, good. Okay. I'm gonna get another one. Hold on. Alright. Okay. What does it smell like? What does this one smell like? What does this one smell like? What does this one smell like? Licorice. Good job, good job. Alright. Now. Okay. What does this one smell like? What does this one smell like? Chocolate. Good job, good job, good job. Okay, now we're gonna do one more. We're gonna do one more. And I think we're gonna do this one. Oh, wait, that's not even it. Okay. What does it smell like? Oh. Sorry. What does it smell like? What does it smell like? What does it smell like? Licorice. Good job, good job, good job. Okay. So you passed. You got all the scents right. You got all the scents right. Now we're gonna move on to smell. side. Good. Soft side. Good, good, good. And dull side. We're gonna do one more. Dull side. Okay. Good job, good job, good job. Good job, good job. Now, I'm gonna poke your face. I'm gonna poke your face. And I need you to tell me where I was poking you, okay? So just hold still, hold still, hold still. Where was that? Forehead. Good job, good job. Where was that? Nose area. Good job. Cheek. Good job, good job. Lips. Good job, good job. Chin. Good job, good job. I hope you didn't hear that. Other cheek. Good job, good job. Okay. Okay, you got it, you got it. Now I need you to tell me if I'm poking you with one finger or two fingers, okay? So close your eyes, close your eyes, close your eyes. Okay. One, good job. Two. One. Two. 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 One. Two. One. One. Alright, good job, good job. Good job, good job, good job. Alright, now I'm gonna brush your face with this Q-tip. I'm gonna brush your face with this Q-tip. And I just need you to tell me if you feel it, okay? Or, yeah, when you feel it, okay? So close your eyes, close your eyes. Okay, good job, good job. Good job, good job. Good job, good job. Good job, okay. Alright, there we go, good, good, good. Now for the next test, I'm gonna blow some air, and I just need you to tell me whenever if you feel it on your face, okay? Okay, good job, good job, good job. I'm gonna do a different area now. Okay, good job, good job, good job. Good job, good job, good job. Good job, good job. And one more, one more. Okay, good job, good job, good job. Okay, now I'm gonna write those results down. You're doing really good, you're doing really good. Alright. Next, for taste, I have these essential oils. And I just need you to tell me what it tastes like, okay? So, let's stick out your tongue. Alright, and I'm just gonna. What does that taste like? Peppermint, good job, good job. And now I'm gonna get another one. Alright. And what does this one taste like? Lemon, good job, good job. Alright. I think that's enough, I think that's enough. Now, I just need you to stick out your tongue. I just need you to stick out your tongue. Alright, and then can you move it side to side? Hold on, let me get my light actually. Alright, can you move it side to side? Can you move it side to side? Okay, can you move it up and down? Nah, don't be freaky though. Don't be freaky with it. Alright, good job, good job. Good job. Alright, now I just need you to move your shoulders up and down like this, like just drag them up and down. Okay, good job, good job, good job. Now resist me pushing on your chin. Okay, resist me pushing on your chin. Alright, good, good, good. Now resist me moving your head, resist me moving your head. Alright, now I'm gonna do the other way. Alright, good job, good job, good job, good job. Now puff out your cheeks, puff out your cheeks. Okay, and can you raise your eyebrows? Okay, can you raise one eyebrow? Alright, and then can you flare your nose? Can you smile? Okay, and can you touch your tongue to the roof of your mouth? Alright, good job, good job, good job. Okay, so that's everything, that's everything. You are done, and looking at your results, you did pass, you did pass. So,